Hello, everyone. Thank you for joining me. My name is Brittany Martins. I am an LPH MPH student at the University of Colorado School of Public Health. Today, I will be presenting a case study of the Chicago heatwave of 1995 for EHOH 6622, Introduction to Public Health Emergency Preparedness. The Chicago heatwave of 1995 is known as the deadliest stretch of heat ever recorded in the U.S. The death toll is estimated around 730 people. Of these deaths, it is important to note that specific groups based on age, socioeconomic status, and race suffered higher mortality. As you can see in the graphics on this slide, the clusters of deaths are found in specific neighborhoods. Day one, again, we see those clusters beginning to show you those neighborhoods. Day two and day three. So there's day three really quickly. And there was day two. So again, we see those deaths really starting to cluster in those neighborhoods. Additionally, we see that African Americans had the highest mortality of any group. Non-Hispanic African Americans were 1.9 times more likely to die from heat than non-Hispanic whites, and this difference was evident in all ages over 55 years old. I will discuss this issue in addition to the Latino health paradox and urban heat islands later on in this presentation. It is, however, important to note that the temperatures reported on this slide were taken from the O'Hare Airport, which is located in what is considered more of a suburban area, versus the temperatures that can be taken from the city at the Midwest Airport. And the fluctuation between these can be between 1.7 and 2 degrees Celsius. For reasons ranging from illness and immobility to poverty and fear, none were prepared for a weather event of such magnitude. The same was true for City Hall, paramedics, police officers, and others whose belated attempts to mitigate this disaster proved largely ineffectual. So the key players and participants are listed out here, starting at the mayor and ending with the electrical companies. So 5 days before the event, the National Weather Service issued timely warnings about the impending heat wave. On July 8th, the Chicago Sun-Times placed a small article in the newspaper stating, "A heat wave is brewing for Chicago, a suffocating air mass. Hottest of the season, a massive ridge of high pressure is stalling over the Midwest, a superheated dome of dry, sinking air with mercury to go above 100 degrees Fahrenheit by Tuesday." This warning was accurate and recognized several days in advance. This shift in humidity would typically bring a thunderstorm. However, this storm, this heat wave, was not met with the calming, cooling, and mitigating effects that a storm brings. Instead, it created the perfect storm that brought over 700 deaths to a city that was ill-prepared, had poor communication between all of these key players listed. The mayor was informed on early Saturday morning. He was on vacation in Michigan, and the information was from the medical examiner. He stated that huge amounts of heat-related deaths were rolling into his office. This information had traveled kind of up the flagpole, so to speak, from Deputy Chief of Staff Sarah Pang. Also early on Saturday morning, we see the bureau chief of the Chicago Department of Public Health. He was asked for an interview. He accepted the interview, he sat down, answered questions, and realized that the intensity of this heat wave had not yet reached his department's radar. On day two of the heat wave, we see that officials are just starting to take notice. Thus far, the only messaging that had been communicated to the public had come from the media. There were some early messages informing the public to be mindful of the elderly, to move family members to homes with AC, and to be prepared for the extreme heat. However, the majority of the news stories did not take the heat wave seriously. There was actually one entitled "Stop Whining," and it encouraged residents to just go to the mall, even though many of the neighborhoods that suffered the greatest losses didn't have a mall. The key public figures were in denial. They did not activate the emergency plans that could have saved hundreds of lives. By the end of the day on Saturday, the death toll had reached 269 people, and 40,000 people were experiencing loss of power overnight. By Sunday, the death toll was estimated at 400. Paramedics and policemen responded to call after call as the bodies literally piled up one after another. The healthcare system was extremely taxed. Many hospitals were on bypass, it's called, meaning they had no room left for any more people. It was later found that individuals who had been contacted by city social workers, provided education and information about the heat wave, had a reduced risk of death. However, there were not enough workers or volunteers to meet this need, nor was it put into place early enough. The Department of Health was the first to actually act from an emergency preparedness scope, declaring a citywide heat emergency and calling into action 56 ambulances and 600 paramedics. Messages to the public were printed in papers, blasted over the media. Many volunteers and first responders went door to door. However, this did not occur until July 15th, what is considered the final day of the heat wave. On Monday, the governor of Cook County, at the request of the mayor of Chicago, declared a disaster area. This is the first step in getting federal relief funds. And then on Tuesday, we see more refrigerated trucks arriving in response. There were a total of 12 semi-trucks to hold all of the bodies that would be discovered. The water department and the electrical department were very key players throughout this disaster. Energy use vastly increased, reaching an all-time high on July 14th, which was day 2, causing Chicago to experience massive power failures due to this increased use. However, the power company did not see this lack of air conditioning and electricity as an increased risk to death. Instead, they issued rolling blackouts to help sustain power for the southern neighborhoods. As a side note, this huge increase in power led to increased bills, which was a problem for low-income families following the disaster. Across Chicago, communities were opening up over 3,000 fire hydrants to try to cool down and to cool their families down, and they were actually throwing bricks at anyone who tried to come and turn them off. Highways and bridges were buckling due to the heat. Buses and rail transportation were heavily delayed, placing even more stress on the police and ambulance and fire trucks who were used to transport people anywhere they had to go due to this lack of support for transportation. So we see the key players for the state and federal. So for July 17th, we have the Cook County being declared as a disaster area, requesting the federal aid. We also saw after the disaster, several Chicago area state senators called for a legislative hearing. They wanted to investigate why there was a lack of warning by the city about this emergency. The Illinois Commerce Commission also held inquiries to the questionable performance of the city area power companies. Why were they rolling out blackouts? Why was this happening and causing even more issue? And then at the federal level, one of the main things that came out of this was President Clinton announced $100 million in emergency funds. It created the Low-Income Home Energy Assistance Program, which was there to help those families who had that huge increase in their power bill due to running their power during the emergency, trying to cool down their families and keeping everyone safe. Illinois actually received $15.7 million from that. The National Oceanic and Atmospheric Administration launched an investigation into the performance of the National Weather Service during the heat wave to make sure they were communicating properly. And then we have the U.S. Department of Health and Human Services running a special investigation as well of the heat wave. So the public health response. Heat wave planning should be organized around these central principles: identification of lead agency, participating organizations, use of consistent standardized warning systems, activating them and deactivating them according to the weather, use of communication and public education, implementation of response activities, collection and evaluation of information, and revision of the plan. Effective planning could have played a major role in reducing heat-related mortality during the Chicago heat wave. As stated by Dr. Bernard, comprehensive heat response requires involvement of many department and non-governmental organizations. In most of the reviewed plans, heat response is coordinated by public safety or emergency management offices, but a few are based in health departments. However, in Chicago, the public health and the health department resources had recently been cut in the name of efficiency in the city. Compared to 4 years prior, just in 1991, they had 20% less health and human service personnel on staff. Additionally, the city was currently in crisis and operating without activation of a hot weather system during one of the hottest and deadliest days of the heat wave. The boots on the ground were working in a response-only capacity. If individuals were sick, take them to the hospital. If they had died, take them to the morgue. The city was completely overwhelmed. There was a distinct lack of structure and there was a distinct lack of structure that the activation of an emergency response plan would have brought. All medical response teams worked without the support of a larger network. For example, the city could have tripled the number of ambulances they had with them if they had activated resources from the suburbs. Door-to-door messaging in the final days, providing education to vulnerable groups, did have a positive effect on mortality. However, the activation of this preventative education came far too late for over 500 individuals in the first 3 days. The city did not evacuate high-density population neighborhoods to cooling centers, nor were any methods activated to provide those cooling devices, ice, etc., to any high-risk individuals or shut-ins. Public health during the crisis did not work from a place of prevention. Early warnings were not amplified to the public. There was no focus on at-risk neighborhoods, nor were vulnerable individuals such as the elderly living alone tracked or notified in any capacity. Comprehensive response plans are necessary to reduce heat-related morbidity and mortality. Plans should provide for coordinated action across government authorities, involve private sector participants, and be responsive to variable risk factors. We see in this case study the lack of ICS structure and public health involvement. Now let's try to take a look at what we have learned and what has been implemented to prevent a disaster like this in the future in Chicago. Contributing factors to the heat wave. So we have the urban heat island, which I mentioned earlier. So looking at the heat waves, it is very apparent that specific issues amplified the effect of the heat wave. One of these issues we see is the urban heat island effect. Urban heat islands are caused by the concentration of buildings and pavement in urban areas, which tend to absorb the heat in the day and radiate the heat at night into its immediate surroundings. Urban heat islands are an important consideration during a heat wave, including the atmospheric pressure as well as temperature conditions. When comparing the differences in urban to rural heat, Kunkel et al. Looked at significant temperature changes seen in the surrounding areas of Chicago, both rural, suburban, as well as lakefront, and the comparison to temperatures in Chicago. The difference ranged from 1.7 to 2 degrees Celsius. 1.7 to 2.7 degrees Celsius. Higher in the city, and this is due to that absorption of heat. In the rural areas and the areas near the water, the cooling breezes really helps to mitigate this phenomenon. Moving into the Latino health paradox, when you look into the mortality rates, one study by the American Journal of Public Health confirmed 1995 Chicago heat had substantial effects on all-cause and cause-specific mortality, and showed that the heat wave resulted in mortality displacement that affected race disproportionately. Well, it has been confirmed that non-white Black populations are at a higher risk of heat-related illness and death. The other major consideration is that of social connectedness of communities. In Chicago, there are 2 neighborhoods that have been examined. They are located 1 street away from one another. Yet during the heat wave, one neighborhood suffered massive losses while the other suffered hardly any. North Lawndale, which is almost entirely Black African American, and Little Village, which is primarily Latina, Mexican, Mexican American. Both neighborhoods are comprised of low-income minorities. Both have similar proportions of the elderly living in poverty and the elderly living alone. The major difference in the 2 neighborhoods is not their race or their value structure, which is a common thought process. It's not that, but their physical ecology. In North Lawndale, there was a large shift in employment opportunities as business shut down, and families were forced to move to be closer to their work outside of that neighborhood. The neighborhood was left with abandoned businesses, buildings, and many families who were now separated. 1 street over is Little Village, where the population is booming. The streets are packed with businesses, as well as small food carts, activities. There's not a single empty lot or building anywhere. Those conditions foster a certain kind of connectedness and intensity of social life. It is this social connectedness that helped the elderly stay connected in the community and during the heat wave gave a protective effect. Immediately following the heat wave, we see implementation of a new commission on extreme weather conditions, and there was also a new heat warning plan. In the new comprehensive plan, we see 3 phases. Each phase is dictated by the National Weather Service forecasts of different temperature levels at the O'Hare Airport. Temperature at or above 90 degrees is phase 1, called a heat watch. Phase 2 is the heat warning and is activated when there's a heat index at or above 90 degrees for 3 or more days. Phase 3 is the heat emergency, and this is when there's a heat index at or above 105 degrees Fahrenheit. Just a few days later, on July 28, 1995, another round of high temperatures hit the city, and the city was aggressively proactive in their response this time. They immediately opened the air-conditioned centers, delivered ice to shut-ins, set up telephone banks to check on the elderly, and broadcast warnings on TV and radio. Additionally, the Department of Streets and Sanitation delivered more than 1,000 electric fans to elderly individuals who lived alone. So we see this really intense reaction, whereas before they were ignoring it. Just 2 weeks later, they've already learned from their lessons and began implementing this. Changes to the emergency management. Since the heat wave in 1995, Chicago has updated its heat wave emergency response in several ways. The Office of Emergency Management and Communication is now housed under one roof and includes its Emergency Responders Unit, 311 call center, and Traffic Management Authority, all to help the city mobilize during an extreme heat event and to better collect data that helps the city identify its most vulnerable areas. This is the first step into an actual ICS model of response, showing activation of a commander, the assignment of teams and resources, and an ability to communicate with one single department to activate this response. Conducting actual disaster preparedness and response training so teams are knowledgeable, effective, and timely in their ability to respond, as well as understanding when to deactivate the response teams. Additionally, the city began assessing for future vulnerabilities using an analog city analysis. This technology helps to target outreach efforts. Chicago began to advance their investment in outside stakeholders and partnered with the Chicago Field Museum to conduct tailored outreach to at-risk communities and neighborhoods to increase understanding of current and expected future changes. This was relating to future climate norms and to the previous extreme heat events, in this case, the 1995 heat wave. This helped the climate risk resonate with the residents. So they're taking what they've learned about that Latina health paradox, about the urban heat islands, and learning how to communicate with these residents. The subsequent policy change that was initiated, Chicago has initiated several adaptation-related policies to reduce the urban heat island effect. For instance, the city has installed more than 100 green alleys using a porous gravel structure that eliminates dark heat-absorbing surfaces. The city has established grants to promote green roofs and the installation of trees, plants, compost bins, and rain barrels, as well as a landscape ordinance mandates that trees be planted on parkways, parking lots, and loading docks. This increase in vegetation can mitigate the effects of urban heat islands. From an unimaginable loss of over 700 lives to heat-related deaths, we now see a city that has learned from its mistakes, has grown in their emergency response, and is taking heat seriously. Chicago is working to identify areas that could be worsened by climate change and focusing their green infrastructure with a preventative lens to improve these urban areas. Thank you so much for your time today. Here are my references and additional references. Thank you so much.